Okay, we are now recording. So, would you like to go first, or do you want me to go first?
Uh, yeah, that's fine. I can go first.
Okay. Well, I'm ready when you are.
Alright, grab my. Alright, go for it.
Okay. You are dispatched to a 63-year-old male who his wife called and just said he's not seeming right. He seems altered. You are in an urban setting in a major city. You're an ALS service with one medic, one EMT. You're about 10 minutes to the nearest level 1 hospital that can handle pretty much anything you need. That fire will be on scene with you. Weather's normal conditions times 0700, and that is your information you got from dispatch till you arrive on
Okay,
scene.
so my scene is safe, I'm assuming.
Yep, fire cleared the scene and said it is safe.
Okay, so,
And you find your patient laying in his bed at home.
okay, he's in bed at home. Is he responsive to me when I walk in?
Yes, he's responsive, but he's very pale and just seems altered. He's not really making a whole lot of sense. He seems kind of confused, but he does notice you and can acknowledge you. He's a
Okay, so
63-year-old male weighing about 180 pounds.
about 180 pounds. Okay, so I'm gonna, you know, greet him. I'm gonna let him know I'm there to help him. I'm gonna have my partner go ahead and hook up the monitor. So we're gonna put a 4 lead uh, blood pressure, pulse ox, capno.
All right. Your blood pressure is going to be 85 over 60. His pulse rate is 46. SpO2 97%, and he's breathing 22 times a minute. His respirations are normal. The only thing you notice is the blood pressure and the pulse rate, and his pale
Okay,
skin.
okay. Is he? What is he? Is he an A&O4, A&O3?
I'd say he's A&O times two. He's alert to person and place, but he doesn't, or person, place, he doesn't really know like the time or day and doesn't know what happened. His wife just woke him up and said he wasn't
Okay,
acting right.
okay. How long ago was it when he went to bed?
He went to bed about 10 o'clock last night. His wife woke him up at about 6:30. It's now 7 o'clock.
Okay, so uh, he's altered. His blood pressure is low. His pulse is low. So I'm gonna recognize that he's symptomatic bradycardia. Um, According to my protocols, that just goes straight to pacing. So I'm gonna have my medic put the pads on and set up my monitor for pacing, 70 milliamps. And then I'm gonna scroll up until I gain capture, and I'm gonna run him up to about 80 beats per minute.
Okay, you
I'm
do
almost
get
back. I
capture and
started IV.
you get mechanical and electrical capture once you start the pacing.
Okay. Um, I'm gonna have an IV started, 18 gauge left AC. Um, does he seem to be becoming more alert?
Yes, after about 2 minutes, you cycle the pressure. Hits up to 130 over 80. His pulse rate's now 80, what you're pacing it, and he is starting to come around and ask what's going on and what happened.
Okay. Well, apparently, sir, right now your heart is not beating like it should be, and I've got pads on you. That's currently sending electricity through your heart to keep your heart beating the way it should be. Um, has he been drinking okay? I mean, enough water, stuff like that.
Yeah, he seems to be in good health. He's not overweight or anything like that. He
Okay,
doesn't doesn't seem like he's living in a bad living condition or unsafe living conditions.
okay. At this time, we're going to go ahead and get him loaded on the cot, and we're going to get started out to the truck. Did anybody get a medical history on him?
He just normally has hypertension. He's on blood pressure medicine. He doesn't remember how much he took or the last time he took it, but he normally has hypertension on blood pressure medicine. No allergies, no previous cardiac history.
Okay, no previous. Okay,
And he has no
um,
chest pain either.
I'm going to consider running a 12 lead, but I'm not able to run one because we're pacing him, so I'm not going to get a clear, accurate read. Um, I'm going to consider pain medication. If it's hurting him, I don't see. Is he complaining of any pain from the pads?
He says it's uncomfortable, but not like anything insane.
Okay, so I'm going to consider that, but um, unless he starts really complaining a whole lot, I'm not going to give him anything on it. We're going to run emergent to the closest hospital, probably OU in this case. And there's really just, we're just going to maintain vital signs and keep cycling everything. Keep making sure I have capture, so I'm going to check a pulse, a femoral pulse. Do I have one?
Yep, it's still strong and going at the same time the pacer is hitting.
Okay. Um, and my blood pressures are all reading this right around the normal.
Yep, everything now. Your intervention seemed to be working, and he has become fully alert after the time it took to get en route.
Okay. Um, yeah, that's pretty much where I'm going to leave him at right now. I'm just going to continue to pace him. I'm going to call the hospital. Um, um, Let them know that I'm coming in with a 63-year-old male. We originally called for altered level of consciousness. According to the monitor, his blood pressure was low at 85 over 60. Heart rate was 46 beats a minute. 97% on room air. About 22 on respirations. He was ANO2. He was symptomatic. So we started, initiated pacing at 70 milliamps. We adjusted and got capture and mechanical capture at 80 beats a minute. Patient is not complaining of any pain at this time. No other meds have been given. He does have a history of hypertension. Nothing. He's not allergic to anything. We'll see you in about 5 minutes.
Sounds good. All right, I am ready for mine when you are ready.
Okay. Let's see. Well, my computer's being dumb. Okay. So your ALS unit, you're paramedic with an EMT. You were called out to single family dwelling for a difficulty breathing. 63-year-old male, about 250 pounds. Wife is on scene.
How old you say he was?
63.
All right.
And fire's going to be on scene. You're about 5 miles to a level 1. And weather's good. It's about 8 o'clock in the morning.
Okay. So when I arrive on scene, I will determine that the scene's safe. I will consider C-spine, consider additional resources, check the number of patients. When I walk in, what is my general impression of the patient?
You see an elderly man. He's sitting in the living room in his chair. He's a little pale, a little sweaty. Saying he's got left shoulder pain and feels like he can't catch his breath.
All right. I will go ahead and immediately have my EMT hook him up to the monitor and get a baseline set of vitals. And I will go ahead and start getting a 12 lead ready as well, since He's pale, diaphoretic, and complaining of shoulder pain. What are my base vitals?
Your base vitals BP is 160 over 90. Pulse is 110. He is 92% on room air, breathing 18 times a minute, and his blood sugar is 180.
All right. While I have my EMT getting the pulse or the 12 lead ready, I'll go ahead and put him on oxygen since he's at 92%. I put him on a nasal cannula at about 4 liters to start. If that doesn't increase, we can go up to 6 or do a non rebreather. Once I get my 12 lead, what am I seeing in the 12 lead?
Your 12 lead is going to show elevation and leads 2, 3, and ABF of 1 millimeter.
All right, and since I see the elevation and leads 2, 3 AVF, I am going to assume that this is an inferior MI. I'm going to consider this patient emergent, and we're going to go ahead and move immediately to the truck. Once we get in there, does the oxygen help increase his SpO2?
It does increase his SpO2. He's up to about 97% right now.
All right, that's a level I'm comfortable with, so we'll just go ahead and keep him where he's at. I'm going to go ahead and get a medical history. Has he had any cardiac issues, any previous MIs in the past?
No cardiac history. He only has a history of hypertension and type 2 diabetes.
All right, and we said his blood sugar was 180, so that's normal. Does he take any medication for his hypertension?
He takes losartan and glipizide for his diabetes. He was prescribed nitrostat 3 months ago. He doesn't know what it was for or why he got it. He's never used it.
Okay. Is he compliant with his diabetic medication?
He is.
All right. I would go ahead and advise him what the nitro is for since he was prescribed it, but in this situation, since it's an inferior MI, I would try and hold off on it, even though his blood pressure is high enough in the 160 over 90. I don't want to drop it any extra with preload issues due to the inferior MI. So I would consider nitro, but hold off unless he was just in an extreme amount of pain and couldn't handle it. So, as of right now, we're going to go ahead and give him 325 milligrams of aspirin orally so we can get that process started.
Perfect. Okay.
And in this situation, this is going to be emergent. I will go ahead and get en route to the near level 1 hospital and go emergent to that. I would go ahead and call and transfer over the 12 lead that I've taken to the hospital. So once I got a hold of them, I would let them know I've sent them a 12 lead. Tell them I have a 63-year-old male. He was complaining of shortness of breath, had left shoulder pain. He was diaphoretic, pale. His original blood pressure was 160 over 90. His pulse rate was 116. SpO2 was originally at 92. We put him on 4 liters nasal cannula. It increased from 92 up to 97. His respiratory rate's around 18. He has a blood sugar of 180. I would advise them what I found in the 12 lead that was 1 millimeter elevation and leads 2, 3 in AVF, and let them get that over to their cardiologist or doctor on hand to see what they determine. He does not have any cardiac history. He is diagnosed with hypertension. He was prescribed nitro, but has not taken it ever. En route, we did give 325 milligrams of aspirin, but have held off on nitro to not drop the blood pressure. He seems to be tolerating the pain fine. We're about 5 minutes out. Is there anything else we can tell you?
Nope. Did you get an IV en route?
No, I did not get an IV en route, but I will go ahead and get bilateral 18 gauges while en route to have that ready for the if he goes to cath lab or anything like that. So I would get two bilateral 18 gauges in the AC.
Perfect. We'll see you in 5 minutes.
All right, and while en route, I would just continue to monitor him. Probably run another 12 lead to see if there's any changes, any more elevation in any other leads. I would continue to monitor his pain. But since we're so close, I would still probably hold out giving nitro and just continue to monitor his vitals, make sure he does not degrade in any way while en route.
Sweet.
All right. Well,
That's the exact call I ran 2 days ago. Perfect.
well, thank you very much. I'm going to go ahead and stop the recording.